TAVR, abbreviated TAVR, is a transcatheter aortic valve replacement procedure. Transcatheter aortic valve replacement is a lesser invasive way of replacing somebody's aortic valve that has become stenotic without open heart surgery. Typically, it is done through one of the arteries in the legs. The valve sizing is fairly straightforward. It's based upon the CT scan that is done. It tells us what size valve is appropriate. The bigger question is, what type of valve do you use? And we have 3 different valves that are commercially available and 1 that is in clinical trials. So the decision on which valve is most appropriate depends upon patient anatomy, patient clinical characteristics that includes the EKG, and then we determine based upon what we think is the safest approach for the patient and what valve we think is going to give them the best long-term outcomes. That's a more complex decision. I'd like to say it's a matrix decision. There's a lot of gray areas, and some of it depends upon personal choice. So the GBI is one of the largest volume centers for transcatheter valve replacement. We were the first non-trial site to be trained in TAVR in the United States in 2011. Since 2012, our volumes have grown from about 24 cases to about 440 cases last year. The team approach at the GBI is what makes it unique. We have 3 implanting interventional cardiologists and 3 implanting surgeons. We also are unique in that we're one of the few sites that has really taken to heart the idea that it is all about the patient experience. So TAVR is pretty much becoming standard of care for all high-risk and intermediate-risk patients. For the lower-risk patients, I think we still have the jury out there in terms of whether it's the best thing for them long-term. However, there has been a growth in TAVR across this country and in the world where it is very quickly becoming standard of care for a lot of patients. So that means that the number of procedures being done is going to increase, which also means that the number of physicians who need to be trained in this procedure, not just to do it, but to do it effectively and efficiently, is going to increase, because we cannot bring to bear more resources simply because we're doing more cases. We just have to do more cases with fewer resources, but we still have to do it safely and effectively. From my standpoint, as a center that has been at the cutting edge of this, we stand in a place where we want to be able to train future physicians, not just in how to do TAVR, but how to do it effectively and efficiently. And the JI is extremely important because it is an excellent platform where we can train physicians, also sales personnel from other companies, clinical professionals from other companies who are learning how to do TAVR, all the ancillary devices that come with TAVR, the cerebral embolic protection devices that are now becoming standard of care. So all of that needs to happen in an environment where there's a high volume, where there's a lot of interaction with physicians, and the JI is an excellent platform.